my name is Susan Mazanetz, and my presentation is on the effectiveness of treatments for chronic back pain. So I did this as a literature review for my health science capstone class. So my question is, what is the most effective method for relieving or reducing back pain? All my sources are going to be in the bottom corner of my PowerPoints, as you can see. So I split it into two different types of treatments. We have physical treatments, which includes acupuncture, cupping therapy, and massage therapy. And then we have supplemental treatments, which includes prescription medications, CBD, and medical marijuana. Includes, but is not limited to. So why is this topic important? Why did I choose this? So like I said, I was able to do a lit review on something that interests me, and this is a topic very near and dear to me because I personally suffer from scoliosis, which brings chronic back pain with it. I have many family members and friends who suffer from back pain, back conditions, and I have met many people at college who also experience chronic back pain. It is a very popular thing. And in my holistic health class right now, we are exploring many alternative treatment methods, so that kind of sparked my interest as well. So a little bit of background, 31 million Americans experience back pain and 80% of them will experience it at some point in their life. It's a very common issue. Common treatment methods include creams, balms, cooling pads, heating pads, ice packs, therapies, over-the-counter medicine, prescription medications, and also, like I touched on, physical and supplemental treatments. So what I did was I reviewed literature and research. I looked at the methods, results, conclusions, and determined the effectiveness of these treatments in my own personal opinion on how they were reducing and relieving back pain, and which treatments provided the most relief. So all my research is from the National Center for Biotechnology and Information, the National Institutes of Health, American College of Physicians Journals, and PubMed. So starting off with acupuncture. Acupuncture is the insertion of very thin needles through your skin at specific points. It's a traditional Chinese medicine, and it is a very common treatment for pain. So in the study that I found, it was a randomized controlled study. It had 40 participants. 20 of them experienced thread embedding acupuncture once every 2 weeks for 8 weeks straight. So 4 sessions total. And the other 20 just had regular acupuncture twice a week for 8 weeks straight, 16 sessions total. And they use pain scales to score the pain after each treatment. The limitations for the study, there was no background on how to understand these scales and quantify the pain ratings. They didn't use a lot of percentages or give very much numerical data. And there was no way to compare the results of the TEA acupuncture and the regular acupuncture. So here's the results from that section. As you can see, it's separated by like week 1, week 2, week 4, 6, 8, 10, and these are the scores. So this one starts at 6.04 and then goes down to 4.54, down to 3.97. So overall, that shows decreased pain with each continued week of treatment. So pain levels going down, so that just shows effectiveness right there. Second method physically was massage therapy. This is the manipulation of soft tissues, muscles, connective tissues, tendons, ligaments, skin. It's done by a therapist and they use different pressures and movements. So this study had 65 hospitalized patients with chronic pain conditions. They each got massages ranging from 15 to 45 minutes at their bedside. The area, type, and pressure of it varied on each patient's wants and needs, and common areas were head, neck, shoulders, back, and feet. Limitations, like I said, all the participants were hospitalized. Pain was not specific, just was general to like head, neck, shoulders, back, feet. And it was not specific to back pain, which was my main focus, but it did include back pain. So this is the results. The average pain before the treatment was 5.18 on a scale of 1 to 10, 1 being lowest, 10 being highest. 50% of the participants received 1 massage, 42 to 3, and 9 had 3 plus. 83.9% of them lasted 30 minutes, and the average pain afterwards on a scale of 1 to 10 was 2.33, so that decreased down from a 5.18. Most of them felt relief for 1 to 4 hours, then 4 to 8, then 8 to 24, and then 24 plus. So this will have to be a treatment that is kept up with just because the relief doesn't last forever. And 67.2% said they would continue with it, so that shows also that is effective. So 100% of the participants felt relaxed after, 90% felt pain relief after, 70% said it contributed to faster recovery, and 50% said they needed less medication. The third treatment I looked at was cupping. It is an ancient form of alternative medicine. Cups are put on the skin, helps with pain, inflammation, blood flow, relaxation, and it's a type of deep tissue massage. So this study had 7 randomized controlled studies, 425 participants total. So the 2 studies that I picked out of the randomized controlled studies, the first one had 70 participants with chronic back pain. 37 of them experienced dry cupping for 5 minutes a day, every other day for 11 days straight. 33 of them took 0.15 grams of an anti-inflammatory 3 times a day for 12 days. Second study had 98 participants with chronic back pain. 48 did wet cupping 20 minutes a day every 3 days for 3-day rotations. 50 of them did usual care like physical activity, excluding heavy lifting, Tylenols, bed rest, stuff like that. The second study was not specific on the results of the usual care group, and it did not allow for comparison between the cupping and the usual care methods. So the results of this study 1, 57% of the people who used cupping experienced relief greater than 80%, and 27% who used the anti-inflammatory experienced pain relief greater than 80%. In the second study, it wasn't as specific, but 95% experienced pain relief that used the cupping, and 57% of the usual care participants experienced pain relief. So my overall conclusion was that wet cupping was more effective than dry cupping and usual care methods. So next we have prescription medication. This is for more severe pain prescribed by a doctor. I focus on opioids, which is a type of narcotic, and it has serious side effects to it, whether you use it right or whether you use it wrong. So this study had over 1 million participants. Almost half of them used opioids. There was 10 studies included total, and they were just kind of asked about the levels of effectiveness and pain relief to gather the results. This research was hard to find. The results were not consistent. It was so lengthy. It was not summarized very well. Results could be conflicting. There was just so much information in this study, and the side effects did play a big part in the effectiveness. So here's the results. Here's one of the result tables, rather. 5 of the studies had 486 participants total, and overall they showed success. 5 of them, showed little to no effectiveness, and they had over 1,000 participants. Many people use opioids. It's the most popular method, but it's not the most effective method. It has many side effects, including but not limited to addiction, dependence, misuse, potential overdose, constipation, nausea, sedation, vomiting, dizziness, itching, dry mouth, depression, so many. The risks outweigh the benefits of this, which makes it not as effective. So the first supplemental method that I looked, or the second supplemental method that I looked at, was CBD. CBD is cannabidiol. It's a chemical from the marijuana hemp plant. Contains very small to no amounts of THC, and it's really commonly used for pain. So 2 studies that I picked out of all the studies in the review. The first one had 24 patients, wasn't very specific on the methods. Second one had 7 participants who had chronic pain. They took 50 milligrams of CBD twice a day for 3 weeks. The other studies included chronic pain from fibromyalgia, neuropathy, general pain, inflammation, neuralgia, and cancer. This study was not very specific to back pain, and there was not a lot of numerical data included in it. So the results showed that the majority of the participants across all studies reported decreased pain levels and pain intensity, increased quality of life, and increase in quality of sleep, as you can see right here by these 2 results. So it was shown to decrease chronic pain among all the chronic conditions. And honestly, I can personally vouch for CBD. Like I said before, I have scoliosis. I've used the CBD topicals. They work wonderful. I just think they need to do more research on it just because it is so new and they don't have a lot on it. So I will vouch for it. It is very effective. Probably not the most effective, but in my opinion, it is very effective. So the last supplemental method that I looked at was medical marijuana. It's used to treat a variety of diseases and conditions. It does have to be medically prescribed for medical purposes. It has delta-9 THC and CBD, and it does produce a high when consumed, but it is really good for treating pain. So this study had 984 participants. They all took a 77-question quiz on the effectiveness, demographics, usage. 64% of them had chronic pain, 91% was focused in the neck and back, and 20.2% had chronic pain following trauma or injury. I'm going to list from the most common methods to the least common methods of use. So smoking, vapes, edibles, tinctures, concentrates, and topicals. So overall, medical marijuana provided 74.7% relief on a scale of 0 being no relief to 100% being complete relief. And 28.4% of participants said that they would have thought it was more effective if it was more cost efficient and they could buy it more often to use it when they needed it. Limitations to people as to why they didn't think it was as effective included that it was expensive, it smells, there's a social stigma around medical marijuana, not many people in society accept its use, availability and location of dispensaries, and legalities because each state has different laws and regulations and it's not legal everywhere. So, overall, what I learned, these research studies lacked sharing a lot of numerical data, which is what I use to make my personal overall decisions on effectiveness. I like to base it on facts and evidence. And like I said, these are just my personal conclusions on the data that I reviewed. So I would say that all of these methods were effective to an extent. No single treatment was ineffective. So, in that sense, you can base your treatments on your personal preference, wants, and needs. Future directions for these studies. We need to have more in-depth research on back pain specifically. Like I said, that was my focus, but not all of the studies were specific to back pain. They included back pain, but they also included different types of chronic pain in their studies. And more research needs to be done on CBD and medical marijuana since they are so new. There's just not a lot of studies being done on them. So, based on the facts presented to me, the numerical data, the highest percentages of pain relief and pain reduction, and continued treatment, these are what I think are the most effective treatments. So, the most effective supplemental treatment was medical marijuana. It provided almost 75% relief for chronic pain. What else can I say? It just had the most numerical data for me to go off of, most evidence. So then the most effective physical method I would say is acupuncture because it continued treatment consecutively for 8 weeks. Back pain decreased with each treatment each week. And to me, this just shows that it's continuous. It continues to provide relief, more and more relief as you keep up with it. So those are my personal conclusions. Again, I just want to reiterate that I did base them off of the facts presented to me in the research, the numerical data I was given in each research, the highest percentages of pain relief and pain reduction, and continued treatment. And these are my resources.